So today I am going to be doing a video of how to do a sterile dressing change. First off, I would check the notes to make sure that at the doctor's order. I would see if my patient had pain medication within the last hour. I would look up what type of dressing I'll be doing, and then I would find the supplies that I needed. So the supplies, I would need 2 pairs of clean gloves, which I don't have any here today, but I normally would. I would need tape. I would need my dressing tray. I would need some sterile normal saline, which today I'll be using water, and I would need extra sterile gauze. So I would walk into the room. I would wash my hands, do proper hand hygiene. I would introduce myself, say, "Hello, Mr. Boyce. I am your student personal support worker today," and then I explained that I'm doing a sterile dressing change. I would check their armband and ensure that they know their name, ask them their birth date, and then I would explain the procedure of what's going to happen. I would pull the curtain, provide privacy, close the door, turn on the light, then I would raise the bed and lower the rails. Here's my patient, Mr. Boyce, today. My name is Hallie. I am your student personal support worker, and I will be doing a sterile dressing change on you today. Can you tell me your name?
Cooper Boyce.
Okay, and what is your date of birth?
2008, August 19th.
Good job. So I have done my hand hygiene. I have my sterile field here with my normal saline, my tape, and my dressing tray. So I would put my gloves on, and then I would get ready to remove the dressing. So while removing the old dressing, I would pull away from towards the incision. I would slowly rip the tape up. Put that in the garbage. So within checking, while removing the old dressing, I would check for odor and I would check for drainage on it and put it in the garbage. After removing the dressing, I would know for any odor, any type of drainage, and I would have to make sure I know what type of dressing was removed so that I can put the exact same type of dressing back on, and then I would put it in the garbage. Now you can finish. I would look at his incision. Mr. Boyce has some staple sutures in today, and so I would check for edema, necrosis, and any type of sign of infection. So I would do hand hygiene again, put on my clean gloves. I would look over my dressing tray. I would check the expiration date. I would make sure that it has all the supplies in it that I need, and then I would get ready. I would maintain my sterile field by not turning my back, not moving away from the tray or the bedside table, and I would keep my table up. I would pull open my dressing tray, and then maintaining a 1-inch non-sterile border and ensuring not to cross-contaminate, I'd use my left side to open my left flap and my right hand to open my right flap. Then I would reach up, grab the forceps, and use them to pull open. From here, I would bring out all of the supplies, ensuring to keep them on the sterile field, but within the 1-inch border. When I'm done with the forceps, I would set them on the edge of the 1-inch border so the tip of them remains sterile. Now I have my sterile drape underneath of the wound, and I'm going to move ahead with cleaning the incision. So I have my normal saline here. I would have to read the outside to make sure that it was open within the last 24 hours. So by checking the date and the time of yesterday. And if it was open before the last 24 hours, I would throw it out. It's not good anymore. I would get a new one. After I was done with it, I would write the date and the time and my initials. So then I would go ahead and pour it into my sterile field. So to begin cleaning the wound, I would take my first piece of gauze, put it into the normal saline, then with using my 2 forceps, try to drain the excess out of it. And while keeping the corners of the normal saline folded in, I would move here and I would do 1 swipe down the center of the wound, put this in the garbage, and move back. And then again with my second piece of gauze into the saline, drain the excess out, fold the corners in, move over to my incision, go down one side, remove it, and my last piece of gauze, drain the excess, fold my corners in, and move down the other side. And then now I will be drying the incision with the same technique. Grab my sterile gauze, fold it so the corners are on the inside. And 1 swipe down the middle, dispose of it. Do the exact same thing. One swipe down the side, dispose of it. Grab the last piece. And do 1 swipe down the other side and dispose. And now I will get the gauze to put the new dressing on. I'll lift that over and just drape it on the incision. Now I will get my tape and not using an excessive amount. I will tape the bandage on. Cleaning up my supplies, so I would take my gloves off, put them into the garbage, and then I would remove this sterile field. I would put it all in the garbage together. And put everything in the garbage. And then I would talk to my patient. I would ask Mr. Boyce if he was comfortable. I would remove the curtains or open up the door, turn on or off the light, see if they needed anything else before I left, and then I would go on about my day. After I was done in the room with my patient and I had put all my supplies in the garbage or put in the normal saline where it should go and date and time and initial it, I would go do proper hand hygiene. I would go to the nurse's station and do my charting. I would note what type of dressing I did, if there was anything wrong with it, edema, necrosis, how it looked. I would note my initials and the date and time of when it was changed, and whether it was a doctor's order or not, everything like that.